Now, if you have hip pain from osteoarthritis or other issues in the hip, like bursitis, okay, you can use a muscle therapy system to help you. Now, if you have a hip replacement already, or if you got metal implant, you can still use this, and it'll help you tremendously because after surgery, you can have a lot of scarring in the area, and the stimulation will help to loosen up the scars and the muscle around that joint. All right. So after your surgery, after everything's healed, you can definitely use this, and you should be using it. And if you do have metal implant, and when you put the stimulation on, if you do feel little pins and needle, you simply move the pads a little bit to the side, and that should be okay then. All right. So use the large flex tone pads, and what we want to do is we want to surround the hip. Right. So if your pain is right in the hip joint, so we're going to put 2 pads around the hip, or if you have the luxury of having 4 the large pads, you can do all 4 at the same time. So we want 1 above, 1 below. We're going to stimulate that for about 20 minutes, okay? And it doesn't matter which mode you use, but you do want to turn up to a point where you get some strong stimulation and the muscles moving. Okay, so you feel nice contraction, nice relaxation, relaxing the area, relieving the pain and the inflammation. Now after 20 minutes, we want to switch the pads to different location. Now this time, I want you to put 1 pad right in the buttock area. This is where the nerve is, where the piriformis is, okay? So we're gonna put that right on the buttock, where you put your wallet for the guys out there, okay, right there. And then the second pad, I'll just use this to show you. You want to put right on the groin area, all right? So just 1 pad right in the groin line, like this, all right? And again, do that for at least 20 minutes, all right? So basically, you're doing what we call surround the dragon. You're surrounding that painful joint. So I'm just going to repeat myself here. So to begin with, 1 pad above and 1 pad below, right there. Do that for 20 minutes. After that, 1 pad on the buttock, another pad on the groin line for another 20 minutes for hip pain. All right, good. Now, if you have groin pain, okay, like a lot of athletes out there have groin pain. They pull the groin muscle, and hockey players, other people who push off a lot, or they happen to hit the toe playing soccer, they can pull that groin muscle. So what you do is you put 1 pad around the groin line, and the other one just above it or just below it. And I would do both. All right, to help to relax the muscle and to stimulate the body's own ability to heal itself. So that's for anybody with groin muscle pain. You should be doing this treatment lying down on your back with your hips slightly flexed. Okay, put a couple pillows under your knee so that muscle can be relaxed while you're giving treatment. All right. Same thing with hip. Okay, when you're treating your hip, you should be lying your back or sitting, and then put a couple. If you're lying down, put a couple pillows under your knee so the hip is in a nice, loose position. Let me show you a series of exercises for your hip-related problems. Now, find yourself a good chair, okay, to support yourself, or anything that can support yourself, and just swing your hips back and forth like a pendulum, okay? Don't need any force. Just gently swing that hip. You just want that joint to go back and forth. Again, motion is lotion. You want to lubricate that hip joint. So this is very good for anybody with arthritic changes in the hip joint. Or if you get tight muscle in your hip joint, that will help to loosen them too. So do this as often as you can throughout the day. And after a few months, you'll see a big difference with your joint pain. Now, I'm going to show you some stretching as well. So again, find yourself a good chair to support with. Stand with the bad leg towards the chair. Put the bad leg behind you and support the weight with your hand and go down gently. Then you should feel the stretching on the side of your hip, just like that. Okay. Now, to stretch the groin muscles, I point my toes forward, front, okay, and back foot, and I just go down. Just go straight down and just a little bit forward, keeping my back straight or slightly extended, and just leaning forward, and you should feel the pulling in the front. Now, if you want more stretch, you just have a longer stride. just like that, okay? And to stretch the adductors, I turn my foot sideways. And doing the same motion, I just go down slowly, supporting the weight with your hand. So you can control how much stretching you're going to have. So this, turn the foot out, I'm stretching the adductors. I turn my foot forward, again, like a fencer stand, all right? Just gently go down and slightly forward. So you feel some stretching here and in the front. Okay, so those are good stretching for your hip. Now, to work on any tight muscles that you might have inside the hip area, the gluteus muscle, the piriformis muscle, you just lie on your back, okay? Now this is a two-step process. First, you lift your hip up till it's making a straight line with your back. And then you push your feet away from your buttock. So my feet is going away from me. And that's the action. Now some of you may find it easier to be pushing against the wall or something that don't give. And if you do it right, you can feel the buttock muscle really tense. But the hamstring muscle at the back of the leg here, that stays nice and loose. If you just feel tension in the back of your leg, then that's not correct. You want to feel the tension here. This is the muscle you're working on. And the hamstring stay nice and loose. So push away from you, contract for 10 seconds, and relax. Okay? So lift up, push away. Push, 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 push for 10 seconds. Again, this is tense, this is loose. And relax. And repeat that 10 times. And then do that a couple times a day. That'll help you a lot. Now, if you have problems with your upper leg, okay, I'm going to show you how to put the pads and where to put the pads for each muscle group. So if you have a problem with the hamstring group, so you just put one pad on the lower portion of the hamstring, and then one just in the belly, okay, of the hamstring muscle, just like that, all right? And you just simply turn it on. Now, you want to make sure the muscle's nice and loose while you're treating it, all right? So you don't want to be tensing it up, okay? Just like that, you want to let it contract and relax so that it can go through its workout cycles, and then the blood will circulate better, the nerve will circulate better, and then the muscle will start to heal on itself. Now, if you have sciatic pain going down your legs, okay, this is one area you can use that. But the other area that's crucial is right here in the buttock area. So you want one pad here, and then the other pad, in the location where you're having pain or numbness. So I'm going to talk more about sciatic pain in treatment of low back and sciatic section of the DVD. Now, if you have, let me turn it off, pain on this side here, what we call iliotibial band syndrome. This is what you do, all right? You put one pad on the side of the thigh, and the second pad, there's two locations, okay? One is you put it just in front of your hip here, and then another one just to the back of the hip. What the objective here is to basically relieve the pain, where the tibial band is. That's one sheath that runs here. And the other objective is to normalize the tone of those muscles that's controlling that iliotibial band. So we're going to control the hip flexors and control the hip extensor muscle. So by putting it here, we're going to relax the hip flexors. By putting behind the hip, we're going to relax the hip extensors so that if those muscles pull properly, then this iliotibial band will work better, and then you can have less pain. Now, if you have pain right where the iliotibial band connects to the knee area, then what you do is put one pad, over that area, and the other one in the middle of the iliotibial band. This is very important for those of you who do a lot of sports, especially running sports, sprinting sports. Okay, those areas can be troublesome. Okay, next area, if you have hurt your quadriceps, okay, that's the four muscle that make up the front of your thigh. So basically, again, whichever muscle you feel is giving you problem, you just put the pads over it. And it's very simple. the key is make sure your legs nice and relaxed. So you probably should be just sitting down, letting your legs hang loose, and then let the machine, stimulate the nerve and muscle to restore normal motion and normal function back in those muscles. What the machine does, it basically relaxes the muscle. So if they're too tense, which is usually the case, it'll help to relax it. It also helps to tone the muscle, meaning if the muscle fibers are too loose, it helps to bring it back its normal tonicity. Okay, so it can do both because it normalizes the nerve and muscle function. Now the other thing it does, it helps to stimulate the nerve and blood circulation. And if the blood and nerve is circulating better, you're going to get better, better and faster pain relief, but more importantly, faster tissue repair. So we basically are trying to help the body to heal itself faster, and that's the key here. Now, some of you may be getting what we call patellofemoral joint syndrome, meaning you get pain behind the kneecap, okay? It's not the ligaments, it's actually behind the kneecap. And that can be caused by imbalances of the muscle that control, okay, your leg movement. So if that's the case, I would treat the knee. So go to the section where, I teach you how to treat knees. But I would also treat the muscle of the quadricep, especially this muscle here, what we call the vastus medialis muscle. So we put one pad there, okay, as one, as part of the treatment, and then we stimulate, because we want to make sure the tone of this group and this group are normal, okay? If we do that, then the kneecap will stay in better alignment because you're pulling on it evenly. It's like different cables. If one cable is too tight, then the alignment is going to be off. But if both cables are equally, have equal tension, then the kneecap's going to track better, within the knee joint. So that's going to make it work better. So for the vastus medialis, and then, the other group on the outside, so in the fancy name for this muscle group is the vastus, lateralis, okay? So basically, this is what we do. All right? Time-wise, usually I keep the treatment around 20-30 minutes because that's the time you need to help, to see and measure a big difference in improvement. And repetition, anything from 3 to 5 times a day or as you need it is fine. Again, don't worry about overusing. Now, another muscle group that often causes people problem is the adductor group, okay? The muscle inside your thigh. So this one, okay, you basically put it close to the groin line, okay, right here, that's close to the attachment, is where they usually have the problem. And the other one just a little bit further down. Make sure the pads are not touching. If anytime the pads are touching, the machine, you're not going to feel stimulation because the electrical pulse will go through the pads instead of your body, okay? Again, just turn up to a point where you actually get contraction. Just as a reminder, always let that muscle that you're treating be nice and relaxed. Let the machine do the work. Don't fight it, okay? Just let it do its own work, and then it's going to heal much better, just like that. Okay, and that's it, okay? Best wish to your injuries, and hope you heal very fast. Let me show you a series of exercises for your hip-related problems. Now find yourself a good chair, okay, to support yourself, or anything that can support yourself, and just swing your hips back and forth like a pendulum, okay? Don't need any force, just gently swing that hip. You just want that joint to go back and forth. Again, motion is lotion. You want to lubricate that hip joint. So this is very good for anybody with arthritic changes in the hip joint, or if you get tight muscle in your hip joint, that will help to loosen them too. So do this as often as you can throughout the day, and after a few months, you'll see a big difference with your joint pain. Now, I'm going to show you some stretching as well. So again, find yourself a good chair to support with. Stand with the bad leg towards the chair. Put the bad leg behind you, and support the weight with your hand and go down gently. Then you should feel the stretching on the side of your hip, just like that. Okay, now to stretch the groin muscles, I point my toes forward, front, okay, and back foot, and I just go down. Just go straight down and just a little bit forward, keeping my back straight or slightly extended, and just leaning forward, and you should feel the pulling in the front. Now, if you want more stretch, you just have a longer stride. just like that, okay? And to stretch the adductors, I turn my foot sideways. And doing the same motion, I just go down slowly, supporting the weight with your hand. So you can control how much stretching you're going to have. So this, turn the foot out, I'm stretching the adductors. I turn my foot forward, again, like a fencer stand, all right? Just gently go down and slightly forward. So you feel some stretching here and in the front. Okay, so those are good stretching for your hip. Now, to work on any tight muscles that you might have inside the hip area, the gluteus muscle, the piriformis muscle, you just lie on your back, okay? Now, this is a two-step process. First, you lift your hip up till it's making a straight line with your back. And then you push your feet away from your buttock. So my feet is going away from me. And that's the action. Now, some of you may find it easier to be pushing against the wall or something that don't give. And if you do it right, you can feel the buttock muscle really tense. But the hamstring muscle at the back of the leg here, that stays nice and loose. If you just feel tension in the back of your leg, then that's not correct. You want to feel the tension here. This is the muscle you're working on. And the hamstring, stay nice and loose. So push away from you, contract for 10 seconds, and relax. Okay? So lift up, push away. Push, 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 push for 10 seconds. Again, this is tense, this is loose. And relax. And repeat that 10 times. And then do that a couple times a day. That'll help you a lot. Now, you're going to love this treatment. If you suffer with foot pain from just standing too much, from being on your high heel shoes, if you love a foot massage, or if you suffer pain from having plantar fasciitis, heel spur, if you have arthritis in your joints, okay, from gouty arthritis, which is very painful, rheumatoid arthritis, and degenerative, osteoarthritis, this will help you a lot, okay? This is my optional accessory, the foot relief massage pads. And when you use the foot massage pads, just use them alone. Do not use it with other regular pads. So just use the foot pads alone. Take your socks off because the foot massage pads have to make direct contact with your skin. And oh, by the way, if you have circulatory problem, this is the best thing to stimulate the circulation in your lower limbs, all right? So if you have any circulation problem, do this on a daily basis and you'll feel much better. Okay, so basically, we just take the foot pads, we plug them in, okay? Doesn't matter which side. And take your socks off and sitting down. Now, these foot pads, they do not go in your shoes. They just go on the ground, okay? It's not designed to be put in your shoes. So you just put your feet on, and then you just turn it on, okay? Until, woohoo, that feels nice, okay? Until you actually feel the stimulation and the circulation rising up your legs, okay? And depending how high you turn it up, you can feel the stimulation go all the way up, and it's a wonderful sensation, okay? And you get a really nice massage in the bottom of your feet. So basically help to reduce inflammation, stimulate the nerve, so that if you have any numbness, it's going to help to restore the sensation. So this is very, very important for any of you who suffer with diabetes, okay? If you happen to have chronically sprained ankle or chronic swelling in your ankle or your calf, use this, especially if you're going to be sitting for any length of time. Just put this on the floor when you're sitting in the office or when you're riding on the plane or even in the car for a long period of time, okay? This only uses batteries, so you can take it anywhere. So use that continuously. If you have pain in this toe, this is great, okay? That joint, for a lot of you ladies, you get arthritis in this toe because you wear your high heels and and your toes all get all pushed in like that. If you're like me, I play a lot of sports. I abuse my feet all the time, like I bang things up, and I get so sore from standing all day, doing work at, standing in trade shows and walking for long hours. So I use this at the end of the day. It just relaxes you, okay? Not only that, if you take a close look, these pads, let's turn off, they have those special knobs here. They're designed to stimulate the reflex points to help to balance the nerve energy in your body. Okay, in Chinese medicine, we believe reflexology or foot stimulation can help restore balance in your body. Okay, so I would suggest that you use this on a regular basis to relax you, okay, and to relieve any pain, to restore circulation, reduce swelling. It's just a wonderful, optional accessory to use together with my pain therapy system. Enjoy it. Now the foot pads, if you have these, okay, those do not need to be replaced. They will last you a lifetime. So they're fantastic. And if you do find them don't conduct as well as you like because you got very thick skin on the sole of your feet, or if you happen to have some kind of neuropathy from diabetes or severely pinched nerve in your back, say your feet's all numb and you don't feel the sensation, one thing you can do to improve the conduction is you can actually put a little water either on the bottom of your feet or on the foot pads themselves, and that'll help to make the conduction better, okay? So that's another tip for you. So take care of your electrodes and it'll take care of you. Now, if you have pain in your ankle from a sprain, old fractures, or if you have arthritis in your ankle, or if you have swelling in your ankles, do this treatment. Now take the big pads and then put one on each side of your ankle. Now one thing you have to be aware of is that make sure the pads are not touching each other. See, if the pads are touching each other, then the current will go through the pads and not through your body. So make sure the pads are not touching each other. Very important. So let me space them apart even more so you have a really good idea that they are not touching each other. All right? Okay. So once you got them on, and then you just turn it on. Okay? And just like that. And again, we want to turn to a point where we're actually feeling a little bit of movement in the muscle around the area, because that will help you to get your best results. Now, if you happen to get swelling in your ankle from sitting on a plane or, or sitting too long, period, if you have diabetic neuropathy, you can use this while you're sitting on the plane or when you're traveling anywhere or even when you're sitting in the office for long hours, okay? If you have a recently sprained ankle, then keep this on all day long, okay? You don't have to worry about overusing it. Just, stimulate it and do the exercise. I taught you, I'm teaching you in the DVD, okay? If you do that, you're gonna see much better recovery. Just use it as often, as long as you can. If you have a recently sprained ankle, it'll help to reduce the inflammation, you'll improve the circulation, and speed up the recovery of the, the overstretched ligament. So, and relax the muscle around the area so you get much faster healing than if you, don't do it, all right? Now, if you have a recently sprained ankle and it's really bad, it's all swollen up, you can't put any weight on it, you can't walk, best thing to do is to leave the pads on and keep it stimulating all day long, okay? The more you do it, the better it is. And also do the exercises that I show you in the video. If you have, chronically swollen ankle from poor circulation, or if you have diabetic neuropathy, then again, use it often. Use it while you're traveling, sitting on that plane, sitting in the office, even sitting, watching TV at home. Just use it often and regularly, and you'll see the best results. Now, if you have pain in your ankle from arthritis, or if you happen to sprain your ankle badly, then you should be doing the following exercises, okay? What I want you to do is just move your ankle back and forth in this full range of motion as often as you can. So just like this, okay? Watch. So just moving, point your toes down, point your toes up. Toes down, toes up. toes down, toes up. Just whenever you have a chance, just keep doing that. Pump your ankles, okay? Just pumping it will help it heal itself. Now, you also need to set the ankle back into its place. So what you do is find yourself a step, okay? Hold on to something, and then just step on the edge of the step and put some weight on your legs, okay, to weigh down the ankle. So to push the ankle deep back into the socket, just like that. And also help to stretch out your calf muscle, okay? So just like that. And to strengthen the ankle, then what I suggest, you just go up and slowly sink down. Go up and slowly sink down. And just repeat that every once in a while. So that will help you recover much faster than if you don't do these exercises. Good. Now, if you have knee pain from arthritis, osteoarthritis, rheumatoid arthritis, gouty arthritis, or sports injury, okay, like a ligamentous tear, menisci tear, if the tear is minor, okay, you can actually use my machine to help treat yourself for excellent results. And it's very easy to use. All you do is use the large pads here, the large flexion pads, and put one pad on each side of your knee. Just like that. Okay, and just turn it on until you feel a nice stimulation. All right. Now, besides using the stimulation, you should also be doing the passive exercise I'll be showing you, okay, as part of this DVD series. And you should also take a supplement, especially if you have joint cartilage, degeneration or damage. You should take some joint supplements, and you can always go on our website to find out which supplement is best for that. So I suggest you stimulate the area at least 20 minutes at a time, 3, 4, 5 times a day, or whenever you can. In fact,